The Acupulse fractional ablative CO2 laser is really one of the workhorses in many dermatologists and plastic surgeons' offices. Now, why is that? First, it's a lightweight, relatively cheap device when you compare it to other existing fractional ablative CO2 technologies that is really easy to use. It has a very intuitive GUI that any practitioner using this device will get a hang of almost immediately. The Acupulse comes pre-programmed with a number of different modes that allows you to treat a number of different patient concerns. First of all, laser resurfacing on the face is extremely easy to perform with the established settings and parameters. On the other hand, there are a number of newer modes with the Acupulse system that allows us to treat other factors and other concerns that patients come in with. One of those is the toe touch. A number of my patients, I would say between 10 and 20%, come in at some point with toe fungus. So this device allows us to safely and effectively treat toe fungus in our patients. Lastly, the stretch touch mode of the Acupulse system allows us to treat skin furrows and wrinkles on the face and off the face, making it really easy to target a number of different factors and concerns for patients in a single treatment session, which patients really enjoy.
I was starting to show some signs like dark spots and things that I did not like.
I wasn't comfortable with myself. I didn't feel as old as I looked.
I didn't like my looks at all. I was kind of sad. Didn't like to look in the mirror because all of a sudden there was just this age look that I wasn't used to.
Because I try to take care of myself, and maybe it's good genes, and when I looked in the mirror, or really worse, looked at pictures of myself, I was just horrified. I would just look at these pictures and say, "Mother?" I couldn't believe that that was me, because I didn't feel like that.
It uses an optimized ablation to coagulation ratio, leading to significant efficacy with a single treatment while minimizing thermal damage to surrounding tissue, decreasing the number of side effects, decreasing downtime, leading to overall patient happiness, which is what any practitioner treating cosmetic patients wants.
It was so easy. I expected more. I don't know what my expectations were, but I didn't expect it to be as easy and quick.
After the procedure, you don't hurt at all. There's no pain involved.
I never experienced any pain the whole time.
A really interesting feature, which is not available with other competitive technologies, is that you can treat deep and superficial tissue at the same time. It has the ability with a single handpiece to fire a deep tissue treatment layer followed immediately by a more superficial pass. So you can treat deeper wrinkles or greater tissue regularity at the same time with the same handpiece in the same treatment session as more superficial pigment irregularities, fine lines, and other superficial concerns that patients may have with their skin. On the face or off the face. We treat patients with full face resurfacing. We treat patients on the back of the hands, the forearms, and other areas of the body.
The two good girlfriends, they noticed it within about 2 weeks. They said, "You look great."
I noticed that my skin was tighter. Some of the wrinkles, especially the lines over the eyes, like under the eyebrows, it was gone. It's just gone. It was great. I would do it again. I have already recommended this procedure to many friends and family members. Oh, I feel much better about myself. Now I don't mind looking in the mirror because I know that each day or each week, it's just going to get better and better. It already is better, so I like to look in the mirror now.
I feel confident now. I feel a lot more confident about being out there and interacting with people. And, maybe even, as I said, doing Match.com. I wouldn't ever have thought about it before because of my age. But now I'm thinking about it.